it gonna see me this time? Okay, there we go. Okay, hi, it's Kristen Mims. I'm here to complete CPEB for NUR 170. And today I will be doing the Insulin Administration. Okay. Alrighty, so first things first, I'm going to take a look at my order and I'm going to compare it against my mark. Alright, so I'm going to separate them. Right? Alrighty, so I like to hand it this way. Alright, so I have my patient, Rachel Bellamy. Rachel Bellamy, date of birth is 3/11/1953, 3/11/1953. 38001 is my MR number. 38001 is my MR number for yours as well. There are no known allergies and no known allergies. Perfect. All right, great. So let's see here. So our order is for, so there's two. We have MPH 20 units sub-Q every morning at 7 o'clock. Then we also have regular insulin that is on a sliding scale. That's to be given every morning at 7 o'clock as well. Now I did go ahead and make sure to take Ms. Bellamy's blood glucose prior to administering. It did read that she was at about a 245. So because of that, she will be receiving 2 units based off of the sliding scale that the doctor prescribed. All right. So in total, she'll be receiving 22 units of insulin this morning. Right. So our first things first, we're going to go ahead and grab our medication. Okay. And then this is unlock the Medron. Get it? Okay. All right, so we're gonna get 2 vials, 1 regular. You can see. Okay, we have MPH. All right. Now, point being to remember, clear before clotting. Once administering, we're going to make sure we do our clear regular insulin first, and then we'll go ahead and draw up our cloudy insulin. All right, so first things first is I'm going to go ahead and do my first med check. Okay. Okay, so for medication. Okay. All right, now I'll write med. Start here. I have MPH. Okay. Right dose. 20 units. First 20 units. Route. Sub-Q. Time. We haven't given it yet. Expiration date. Sure. It does not expire. Awesome. Okay, and we'll document what's done. All right, we're going to do the same for our regular insulin. Medication. Confirm the dose, and that one is on the sliding scale, so we're doing 2 units today. Routes. Sub-Q. Time we haven't gotten there. Expiration. Okay, it's not expired. Document once we're done. All right, great. So our next step will be to draw up our medication. Okay, so I'm going to wash my hands. Okay. And on my gloves. Okay. Now I'm going to clean both of the vials. Alcohol swabs. These things are old. Okay. Clean, 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 clean. Leave those on there. And then now we're going to grab for our second vial. Clean, 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 clean. Oh, sorry. Sorry. I'm nervous. All right, so just gonna leave that on there as well. Okay. So that's good to go. So for this, because insulin has to be given in a specific type of syringe because it is based off of units. I don't have one here, unfortunately, but we are going to pretend like this is it. Of course, it's the very slender syringe. It has the orange top on it. And, well, Maybe this will recognize, orange. Okay. So, all right. So first things first, will be to make sure that I have enough air in my syringe, so that I can get the appropriate amount of medication. Okay. So I'm going to actually step back. Prior to cleaning, I probably should have but I should have rolled up my MPH insulin, not mix it, because it is cloudy, has that sedimentation in it. I want to make sure that's completely incorporated, so that it doesn't have any adverse effects. So I'm going to demonstrate how I would have done it, but before cleaning the vial top, I definitely would have done that first. So preds. Okay, so I'm going to, and again, now I have 20 units of MPH that I'm going to be using. So because of that, I'm going to draw in 20 units of air in my syringe. Okay, just pretend like and I would get eye level with it as well to make sure, because the lines can be kind of small. So I want to make sure I get the correct and accurate amount. Okay, so draw it in. Okay. All right. Now, I'm going to enter that amount into my MPH. Okay, just the air. We're just putting the air in there. Okay, and then remove. Okay. Now I'm just needing 2 units of air for my regular. Some of these have the automatic cap, some don't. I guess it just depends. I would prefer to cap it for myself, but all right. All right, so 2 units. And then we're going to enter that into the regular insulin. This is me trying to insert, but it would be flat for sure. And I would eye it as well to make sure I have exactly just those 2 additional units, in total 22. So, okay. All right, into those. Now we're not going to discard the syringe from the regular insulin because I need to draw that first. All right, so now 2 units of air in there. Basically, I would have only drawn 2 units of air, and then now it's in this regular syringe, and so now I'm going to draw 2 units of actual insulin. It's kind of hard. Okay, just to make sure it's right on the money. Okay, all right, awesome. Okay, now I'm going to go back to my MPH and draw 20 units. And again, this already has air in it to assist with that. Okay. All right. So now in total, I should have 22 units of insulin. And I want to make sure I have exactly that. Okay. All right, perfect. All right. That's that cap. Got my cup. All right, so I want to make sure I get this labeled. And that will be with my initials, today's date. Today's St. Patrick's Day. The MR number, 38001. Our dose. Okay, and our expiration date. Again, these are all within the expiration date, but you still want to make sure you have that on here. And our med. Okay. Alrighty, so now we have that there. Oh, let me go ahead and apply the label. This label I created specifically for this patient, for this medication, right on here. Again, I don't have any tape, but I'm just going to slip it right through the pin area so it hangs off there, making sure not to cover any of the numbers or values. All right, I'm going to go ahead and do my second check, and that will be including my drawn up syringe as well this time, including that. All right, so all right, everything is confirmed. Identification, right med. Okay, we're gonna look at all of our stuff, make sure it's correct. The right dose. Yes. Okay. Give me the right route. Of course, that is sub-Q. Time, we haven't given it yet. Expiration. Right now, this is for my NPH. NPH is going to be August 2021. And I'll document what's done. And then we'll do the same. My regular. Just gonna identify Rachel Bellamy, 30111, 311-1953, 311-1953. No non-designated allergies, no allergies. All right, so I'm using some Q. Okay, medication. And this is based off that sliding scale. Okay, regular, medication, medication. Medication. Okay. Our dose. Well, the root's based off the side. Okay. The dose based off the sliding scale. And then our root is going to be sub-Q. Q. Alright. Time we haven't given it yet, and this expires August as well. Document once we get there. Perfect. All right, now because this does have both types of insulin in it, I want to make sure that I was able to obtain her blood glucose prior to drawing up the medication. Plus, I needed to know what her glucose was in order to determine how much I would actually be giving her. So that's already been taken care of. It is within range. And now we're just going to go grab our items. Okay, we have our check card. We'll check all of our med checks. Okay. All right, we have everything. We have our syringe. I'm going to get another alcohol swab. I'll grab 2 just in case. And at this point, I would have taken off my gloves and washed my hands as well. So I'll correct that. And discard of my trash. I'm going to put my medications back in their appropriate areas in my cart. Let's pretend like this is where it is. All right. So my medications are away, and I am locking my cart. Okay. All right. Now off to our patient's room. Okay, turn this around again. I don't want to stop this time. Okay, so this is my little tray area. Better. Yes. Oh, you can't see me. Okay. There we go. All right. So we have all of our things. We're gonna go into our patient's room. Okay, knock, knock, knock. Hi, this is Kristen. I'm your nurse today. Open curtain, wash hands, remove call light. Well, close curtain, provide privacy. All right. May I have your name, please? Raise the bed. Okay, raising the bed. Patient says Rachel Bellamy, and then I take a look at her wristband. And can I have your name and date of birth, please? Perfect. That's exactly what I have. All right. And do you have any allergies to food, latex, any medications? No, you do not. Okay, great. Great. So today, again, bed is raised up to highest position. Privacy is applied. My hands are washed. The call light is out of the way. All right. I think that did everything. Okay. All right. All right. So yes, Ms. Bellamy, today I'm going to be giving you your insulin. I'm sure you're familiar with it, but I just wanted to let you know. Now, this one is mixed with 2 separate types of insulin. One takes a little bit longer to take effect than the other. So because of that, we're going to be giving you a shorter acting regular insulin as well. Okay, are you familiar with those? Patient states yes. Okay, so we're going to be giving you 20 units of the NPH. That's the longer lasting one. Well, the one that takes a bit longer. And then we're going to be giving you 2 units of the regular insulin. Now, I did see that they just brought down the breakfast trays. So I'm going to make sure that we bring that food in for you once we go ahead and get these medications into you, only because the regular insulin, it doesn't take very long to start working at all. Maybe sometimes within about 10 to 30 minutes. So I want to make sure you have something in your system so we don't have any adverse issues, okay? All right, awesome. All right, so I'm just going to go ahead. These are my items, my things. This is the syringe, stuff on it. And some Mars and all that. And sorry. Okay, and this is going to be where my Dr. Ted, and we're going to do my our third med check. So, all right, we're going to compare it against everything. And now this time we're comparing everything. We have our wristband, we have our syringe, we have our we have everything. We're going to go ahead and confirm one last time that we do have everything that's appropriate to distribute this medication to this patient. All right, so we have kind of parts. Desk would be good. All right, so all right, Rachel Bellamy, 38001, 38001. Patient Lamar, 38001. And patient states no allergies. Perfect. Okay. All right, now we're going to go with our med. Okay. Check here. Patient again. I am also looking at the patient's wristband as well. It's very important to say that. I know you can't really see me, but make sure to look at the patient's wristband while confirming. Okay. I'm going to check my label. All right. My medication. All right, and our dose. 20. Checks out. That's what we have on here. What we have here is identification, our medication, our dose, our routes. It's going to be subcutaneous. And checks on each. And the time. The time is now. We are giving it. Okay. Expiration. We check again. Expiration dates are within the time frame. And we'll document. All right, and then we'll go ahead and take care of our last one, our regular. Okay, so we are Rachel Bellamy. And remember, taking a look at the wristband. Sorry. Our number. All right, remember. And syringe has that as well. Medication. So regular. Confirm. Medication. Confirmed. Right piercing. Confirmed. The dose. This one is going to be the 2 units of the regular. Okay, I'm looking at syringe. Looking at the wrist. Right. And again, this route is going to be subcutaneous per the order and per the proper standard, of course. Okay. All right, and again, the time is now for this. Expiration date, and we'll document. All right, perfect. Okay, great. Now, Ms. Bellamy, before I get started, did you have any questions for me? Again, patients take some questions. All right, so I'm going to go ahead. I'm just going to expose, where did you have, I'm going to ask my patient where they had their last injection. She states that she had it on her right lower quadrant. I'm going to go ahead and give her the injection on her left lower quadrant. Okay, I'm just going to expose you very briefly. Oh, the Band-Aids. All right. All right, so I'm just going to, okay, so I'm going to wash my hands, don my gloves. All right, just going to wipe down this area. It's going to be the lower left abdomen. Now, once we're done with this, you don't want to rub it or anything like that. You just want to kind of let that be. You don't want any irritation. Okay, so gloves on. All right, so I'm going to grab my syringe, labeled syringe. Okay. Can't see. All right, so I'm going to grab the subcutaneous fat area. All right, squeeze. All right, 1, 2, 3. All righty. Perfect. Okay, great. So yeah, you want to just leave that alone for a little bit. All right, no need to band-aid that or anything like that. So I'm going to, well, previously I would have taken off my cap, thrown that in the garbage, and now I'm going to take my used syringe and throw it in the sharps container, I should say. This is done. Alrighty, perfect. So I'm going to discard my gloves. All right, let the head of the, wash my hands. All right, I'm going to put my patient's bed down, raise the head of the bed. Okay, give the call light. Now again, Miss Bellamy, did you have any questions for me? Not right now. Okay, well, I'm going to go ahead again and bring back your food. I'll be right back in and we can go ahead and get some food in you, just because we did give you that insulin, okay? Alrighty, so head down, bed lower at the lowest position, especially since I'm leaving. Call light, head of bed up, open the door for privacy, and close the door. All right, thank you guys. Bye.